What is Omicron? It's a mutated coronavirus variant also known as B.1.1.529, which has been designated as a variant of concern by the World Health Organization. According to the National Institute for Communicable Diseases, the NICD, the B.1.1.529 lineage was detected in South Africa on the 22nd of November 2021 at a relatively high frequency. The Omicron variant was first reported to the World Health Organization by South African scientists on November 24, 2021. But the first confirmed infection was identified a couple of weeks prior in Botswana. The Omicron coronavirus variant was present in Europe before the first cases were reported in South Africa, new data from the Netherlands showed. At this stage, scientists are still trying to establish some of the immune responses to the new variant. Health experts don't know whether the Omicron variant is more transmissible, causes more severe disease, or affects vaccine efficacy. As the festive season approaches, scientists are urging all South Africans to be cautious. Dr. Michelle Groom, head of the Division of Public Health Surveillance and Response at the NICD, said, if people remain steadfast in implementing physical and social distancing and wear their masks, transmission of the disease and ultimately the negative impact on our health sector will be lessened. New variants are expected to continue emerging wherever the virus is spreading. Scientists at the NICD maintain that vaccination remains critical to slow transmission, protect us from severe illness related to the coronavirus, as well as reduce strain on the health system. Professor of Vaccinology at the University of the Witwatersrand, Shabir Mahdi, recommends that adults who receive the Johnson & Johnson vaccine get booster doses since a single dose of J&J only reduced hospitalization from the Delta variant in South Africa by 62%. Mahdi is also championing the implementation of vaccine passports for entry at indoor gatherings. Even if vaccines only reduce transmission modestly over and above the infections they prevent, a breakthrough case in a vaccinated individual poses less risk of transmission to others than infection in an unvaccinated and previously uninfected individual, he says. Additionally, he is pleading with government to ensure that South Africa's healthcare facilities are prepared and adequately resourced with staff, personal protective equipment, and oxygen. In Mahdi's list of recommendations, the government should not announce regulations that are not implementable or enforceable in the local context, nor should the government impose domestic or international travel bans. But while South Africa remains on alert level 1 with open borders, other parts of the world have been met with heavy criticism for banning South Africans following the reporting of the new variant in the country. Mahdi said travel bans, especially concerning the Omicron variant, are ineffective because it has already been detected in several other countries, making the spread inevitable. President Cyril Ramaphosa called on countries to immediately and urgently reverse the travel curbs, which he said was scientifically unjustified.
Now, these restrictions are completely unjustified and unfairly discriminate against our country and our Southern African sister countries. The prohibition of travel is not informed by science, nor will it be effective in preventing the spread of this variant. The only thing the prohibition on travel will do is to further damage the economies of the affected countries and undermine their ability to respond to and also to recover from the pandemic. We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people. There is no scientific justification whatsoever for keeping these restrictions in place.